Prostate cancer begins when abnormal cells in the prostate, a small gland that produces seminal fluid, start growing uncontrollably. The prostate is located below the bladder and in front of the rectum, and its main function is to secrete fluid that nourishes and transports sperm. Normally, the prostate cells grow and divide in an orderly way, but in prostate cancer, this process becomes disrupted, leading to the formation of malignant tumors. The exact cause of the transformation of normal prostate cells into cancerous ones remains unclear, but it is believed to involve a combination of genetic, environmental, and hormonal factors. As men age, the risk of developing prostate cancer increases, especially after the age of 50. Family history also plays a significant role, with men whose close relatives have had prostate cancer being at higher risk. Moreover, African American men are more likely to develop prostate cancer compared to other ethnic groups, and the disease may be more aggressive in these individuals. Lifestyle factors, such as diet and exercise, may also influence the development of the cancer, though the evidence remains mixed. At the cellular level, changes occur in the DNA of prostate cells. These genetic mutations can cause cells to grow and divide uncontrollably. In the early stages, prostate cancer may grow very slowly, and many men may have a disease without knowing it, as it often does not cause any symptoms initially. However, as the cancer progresses, it may form larger tumors that begin to affect surrounding tissues and organs, spreading beyond the prostate in a process called metastasis. The most common areas for prostate cancer to spread are the bones and lymph nodes. The progression of prostate cancer can vary widely. Some forms of prostate cancer grow very slowly and may never cause significant problems or symptoms during a man's lifetime. In contrast, more aggressive types of prostate cancer can spread quickly and pose serious health risks. In many cases, the cancer remains confined to the prostate for years without spreading. As a tumor grows larger, it may press against nearby organs or structures, such as a bladder or rectum, leading to urinary difficulties, pain, or blood in the urine or semen. Although the exact cause of prostate cancer is still under study, several key factors, including age, family history, and ethnicity, are well established as contributing risks. Understanding how prostate cancer begins and progresses can help in the development of screening methods, treatments, and preventive strategies. As prostate cancer progresses, it may lead to a variety of symptoms, although many early-stage cancers are asymptomatic and can remain undetected for years. However, once the cancer begins to spread or grow larger, it may cause more noticeable signs. These symptoms can include frequent urination, especially at night, a weak or interrupted urine flow, difficulty starting or stopping urination, painful urination, or blood in the urine or semen. Some men may also experience discomfort in the pelvic area or lower back, and in more advanced stages, pain in the bones or hips may occur if the cancer has metastasized. The spread of prostate cancer to other parts of the body, particularly the bones and lymph nodes, can significantly impact the patient's health. When prostate cancer spreads to the bones, it can lead to bone pain, fractures, and complications like spinal cord compression. If the cancer spreads to the lymph nodes, it can cause swelling in the legs or pelvic area and may also make it harder for the body to fight infections. These complications are typically more common in later stages of the disease. The risk of prostate cancer developing into a more aggressive form often depends on the genetic mutations that drive the cancer. Researchers are continuously investigating the genes involved in the development of prostate cancer to identify patterns that could predict the cancer's behavior. Certain mutations, such as those in the BRCA1 and BRCA2 genes, are known to increase the risk of prostate cancer. These genetic mutations are also associated with other cancers, including breast and ovarian cancers. Men with a family history of such mutations may be at higher risk for developing prostate cancer. In addition to genetics, hormones also play a crucial role in the development of prostate cancer. The prostate gland is sensitive to male hormones, specifically testosterone. Testosterone fuels the growth of prostate cells, and in many cases, prostate cancer cells rely on this hormone for their growth. As a result, treatments that block or reduce testosterone levels, such as hormone therapy, can be effective in slowing down or stopping the progression of the disease. The early stages of prostate cancer are often detected through screening methods such as a prostate-specific antigen, PSA, test or digital rectal exam, DIE. PSA is a protein produced by the prostate, and elevated levels in the blood may indicate the presence of prostate cancer, although high PSA levels can also be caused by other conditions like benign prostatic hyperplasia, BPH, or prostatitis. The DRE allows a doctor to feel the prostate for abnormalities or lumps, but these screening methods are not definitive and may require further testing, such as a biopsy, to confirm a diagnosis. Once diagnosed, prostate cancer is classified based on how much the cancer has spread. Staging helps doctors determine the extent of the disease, and the most commonly used system for this is a TNM staging system, which takes into account the size of the tumor, T, where the cancer has spread to nearby lymph nodes, N, and where the cancer has spread to distant parts of the body, M. The grade of the cancer is also important in determining its aggressiveness. The Gleason score, which grades cancer based on its microscopic appearance, helps predict how likely the cancer is to grow and spread. Treatment options for prostate cancer depend on the stage and grade of the cancer, as well as the patient's overall health and preferences. For localized prostate cancer, cancer that has not spread beyond the prostate, treatment may include surgery to remove the prostate, prostatectomy, radiation therapy, or active surveillance, monitoring the cancer closely without immediate treatment. For more advanced or aggressive forms of cancer, treatment options may include hormone therapy, chemotherapy, immunotherapy, or targeted therapies. In some cases, a combination of treatments may be recommended. Active surveillance is often an option for men with low-risk prostate cancer, especially for older individuals or those with other health conditions that might make treatment risky. During active surveillance, the patient undergoes regular monitoring with PSA tests, X-rays, and imaging studies to track the progression of the cancer. If the cancer shows signs of progression, treatment may be initiated. In cases where the cancer has spread to other parts of the body, metastatic prostate cancer, the primary treatment goal is to control the spread of the disease and alleviate symptoms. Hormone therapy is commonly used to reduce testosterone levels, as many prostate cancer cells require testosterone to grow. In some cases, chemotherapy or newer immunotherapy drugs may be used to target cancer cells more aggressively. In conclusion, prostate cancer begins with changes in the prostate cells, often driven by genetic mutations, hormonal influences, and other risk factors. While many early-stage cases are slow-growing and asymptomatic, the disease can become aggressive, spreading to other parts of the body and causing significant health complications. Advances in early detection and treatment options have significantly improved the prognosis for many men with prostate cancer, but the disease remains a major health concern. Ongoing research continues to improve our understanding of the disease's development and provide more effective ways to treat and prevent it. As the field of prostate cancer research continues to evolve, new methods for early detection and personalized treatment are being developed, offering hope for better outcomes. One promising area is the use of genetic testing and biomarkers to tailor treatment plans to individual patients. By analyzing the genetic makeup of the prostate cancer cells, doctors can identify specific mutations or alterations that may respond better to certain therapies. This approach, known as precision medicine, aims to provide more effective and less invasive treatments based on the unique characteristics of a patient's cancer. One example of personalized treatment is the use of PARP inhibitors for patients with certain genetic mutations, such as those involving BRCA1 and BRCA2. These drugs work by targeting the cancer cell's ability to repair damaged DNA, making them more susceptible to treatment. Similarly, other targeted therapies are being explored to block the specific pathways that allow prostate cancer cells to grow and spread. These therapies could help slow the progression of the disease while minimizing side effects compared to traditional treatments like chemotherapy. Immunotherapy is another exciting area of research in prostate cancer treatment. This approach uses the body's immune system to recognize and fight cancer cells. One type of immunotherapy currently being studied is immune checkpoint inhibitors, which work by blocking the signals that allow cancer cells to evade detection by the immune system. While immunotherapy has shown success in treating other cancers, its effectiveness in prostate cancer is still being explored in clinical trials, with some promising results emerging. In addition to systemic treatments like hormone therapy and chemotherapy, advances in localized therapies are also being explored. For example, high-intensity focused ultrasound, HIFU, and cryotherapy are emerging as alternatives to traditional surgery or radiation for localized prostate cancer. These treatments aim to destroy cancerous tissue using heat or cold without the need for invasive surgery, potentially offering patients a quicker recovery time and fewer side effects. Supportive care is another critical aspect of managing prostate cancer, especially for those with advanced stages of the disease. Palliative care focuses on improving the quality of life of patients by managing symptoms such as pain, fatigue, and loss of appetite. This care approach also involves helping patients cope with the emotional, psychological, and social challenges that often accompany a cancer diagnosis. Counseling, support groups, and palliative treatments like bone-strengthening medications and pain management therapies are important parts of the overall treatment plan. As we look ahead, the goal for prostate cancer treatment is to strike a balance between effective therapy and preserving the patient's quality of life. Continued advancements in early detection, personalized treatments, and patient-centered care will likely improve outcomes for men diagnosed with prostate cancer, particularly for those whose cancer is detected in its early, localized stages. However, despite the progress, challenges remain in ensuring all patients have access to these new treatments and technologies. Disparities in healthcare, including access to care, early screening, and specialized treatments, can lead to unequal outcomes. Addressing these gaps, particularly for underserved populations, is crucial in the fight against prostate cancer. Continued research into understanding the disease's origins, risk factors, and genetic components will be key in developing more precise interventions and preventative measures. In conclusion, while prostate cancer continues to be a significant health concern, ongoing advancements in research and treatment are helping improve survival rates and quality of life for many men. With improved detection methods, personalized therapies, and ongoing support for patients, the outlook for those diagnosed with prostate cancer has become more positive. The continued pursuit of a deeper understanding of the disease, combined with advancements in medical science, offers hope that prostate cancer may become more treatable and manageable in the future, leading to better outcomes for men worldwide.